Every year, 27 million couples struggle from infertility in India. Still, we whisper about it. One in six couples globally struggling to conceive, and 40 to 45% of that population is contributed due to male infertility. And still, when we have the conversations, men are out of the topic. The finger always gets towards the women of the society. So, how IVF can help in this? Using IVF, a couple can conceive, and it has a success rate of 50 to 60%. In today's conversation, we break down IVF into layman's language. What is IVF? What is embryo freezing? How does empathy plays such an important role in this journey for the couple? So, if infertility, IVF, parenthood, any of these are in your roadmap, this conversation can help you altogether. Keep listening and don't forget to like us, follow us, and subscribe to our channel, Arrey Wah.
Hi everyone, welcome to Arrey Wah. Today we are talking to a doctor couple who are experts in their own field of assisted reproductive technologies and founder members of the prestigious Abha Surgery Center in Kolkata. Dr. Bani Kumar Mitro, founder and chief consultant, Dr. Konkon Mitro, a renowned clinical embryologist in the country, director and chief embryologist at Abha Surgery Center. We will hear more from them and enhance our knowledge as we continue our conversation. Dr. Mitros, welcome to our podcast. We are delighted to have you with us.
Dr. Mitro, say something about how you started this Abha Surgery Care Center, how it evolved. Then we will get into the depths of IVF and more technical topics.
Actually, since my college days, I was attracted to Professor B.N. Chakravarti, who is the doyen of IVF in not only in Calcutta but all over India. We learned the basics of infertility from him and spent several years at the Institute of Reproductive Medicine. So from there, the idea of starting a career in reproductive medicine started. And then it finally took shape. And when I came back from UK, we started Abha Surgery Center with the aim of giving low cost IVF, not only IVF, but infertility treatment to middle class people so that making it affordable and approachable for all the people. Clinic, and that was 30 years before. We also have couples coming from Nepal, from Andamans, even from UK and USA, Australia.
We will dip dive into IVF more. But, ma'am, being a lady myself, right, I think the woman still carries a lot of mental, emotional, physical stress, and then a societal stress is also there. So, how do you handle this with your, counseling process?
So we basically cater to Asian women. Where after a marriage, after 1.5 years, people start asking, "Good news, ta kobe pabo?"
Exactly.
So that's when the patient comes, and becoming a mother is something which is very important. So a lot of women, they're different classes. One is they just need a baby. There is another class who are super educated and they have few eggs. So that's very different to counsel. It is just empathy and with a little bit of spiritual guidance. Then we counsel about other things, that you must complete your family early. When a young girl comes with PCO, it's just meeting patients, talking to them.
But
So
that's a
this
very
is how.
important part, I will say, ma'am. As of now, there is a lot of stigmatization which we have in our country, especially on the lady or the woman of the house.
That is the problem. In our part of country, the females are pressurized a lot and males are let apart. But although male factor contributes about 50% of the cases of infertility, and it is rising. We actually have a compassionate, individualistic approach. That is how we really counsel them.
Dr. Mitra, first we'd like to understand what is an IVF, very simplified version of, if you can tell.
Actually, IVF means taking out eggs from the wife, collecting sperm of the husband, putting them together in the lab, making an embryo out of both, and then placing it back inside the uterus for the baby to come out. Now, basically, IVF consists of 4 steps. One is giving injections to the woman to produce eggs, and our idea is to get 8 to 10 eggs or perhaps 12 eggs at the most. Then, once the eggs mature, we take it under ultrasound guidance, we take them out of the ovary and we deliver to the lab. There, the sperms are collected, and depending on the seminal condition, a normal IVF is done. That means the sperm and the eggs are placed in a petri dish and allowed them to fertilize. Or if the sperm count is less or the motility is less, we take one sperm, inject inside the egg, and that is called the process of ICSI to achieve fertilization, gives a better success rate. Nowadays, we don't do a fresh embryo transfer. Means that cycle we do the egg pickup, we don't do usually transfers the same month. We actually will freeze all the embryos, and then later on we prepare the uterine lining of the uterus, that is called endometrium, and then we transfer the embryos. In that way, the success goes up. So every percentage of success counts in IVF, because at the end of the day, not everybody will conceive. The success depends on the age of the patient, the duration of marriage, a host of other conditions. So every IVF center tries to give birth to a baby.
When you say the lady gets injected with certain medications, so how stressful is it for the lady in the house?
That is where the actual pre-treatment counseling is very important. One should be counseled properly, and the most important side effect or dropout rate of IVF is stress, and the second is economical conditions. So that is how we should give a clear guideline to the couple that this is your approximate cost involved, and this is your success rate, this is your failure rate. So you must be prepared mentally and physically for that. Now, at different stages of stimulation, patient can encounter a stress. That means when we are giving injections, if the desired amount of stimulation or number of eggs coming up is not up to the mark, then she might feel dejected. Her expectation was to get 10 eggs, but only 4 are growing. And then again, when the eggs are taken out and fertilization takes place, if the fertilization is not up to the mark, like sometimes very rarely we have cases of failed fertilization where the sperm doesn't fertilize the embryo. These are really intricate reasons of infertility which IVF can only discover. Nothing else can discover them. And lastly, the most important is a failure of after embryo transfer, when the pregnancy test is negative or when the period starts. So these are the different phases in a cycle of IVF where a woman feels stressed, and that is why the doctor, or she must talk to the counselor, or the clinic staff would be very cooperative and positive in their approach to tackle that situation. If a failure occurs, you should ask the couple to come back as soon as possible, to counsel them, to analyze the cause, to prepare them mentally, economically, medically for another cycle when they are ready to do so. So there should be in everything there should be a positive approach. And I have seen that patients who stick to IVF, they will definitely conceive once in a while.
So, like IVF is a very, very stressful condition, and the women these days, they have to manage their house, they have to manage their career, the timing along with their office. So, in generally, with these hormonal injections which they take, there is a lot of water retention, mood swings. So, this is where you need a team of doctors and of this doctor's assistant, the phlebotomist who take the blood, who have to be a little empathetic, because she's undergoing a lot of stress, and along with it comes a big financial burdens with a lot of uncertainty. This treatment will not assure you of a baby. So these are the things which add to the burden.
Ma'am, your specialization is clinical embryology, right? So would you like to explain that and how that fits into this story of IVF?
Clinical embryology is when you are dealing with the human oocytes and the human sperm. This is called an assisted reproduction, when you are taking the oocyte out of the human body and you are manipulating it in the lab. So when I was trained way back in 1998, this was in Singapore and National University. I was one of the first trained embryologists in the country.
Actually, Embryology forms an integral part of an IVF because without a proper lab, without proper embryos, one cannot expect success.
Oocytes টা exactly কি? Is that same
Egg.
as the eggs?
It is the egg. Oocytes is the
আচ্ছা
medical term for egg.
আচ্ছা
And it's a gamete. Gamete হচ্ছে, it's a gamete can be a male gamete, which is called the sperm, and the female gamete is the oocyte. And both together form the embryo.
So should we say that this IVF is only for the wealthy people?
I mean, it was once upon a time considered to be only for the wealthy people. But now, with the economic growth of the country, IVF is becoming more and more affordable. Nowadays, improvement in the technical aspects, the products, the labwares, so IVF has become very streamlined. And the availability is more. Like I remember when I used to come from England, I used to carry progesterone injections for BN Chakravarti from UK. That was my present to sir. So, but now it is readily available. So things have become easier. And with that easier things, approachability is different and the cost also is going down. But having said that, there is still a part of society who needs IVF, and for them, IVF is pretty costly. So we need to really think about it. And that is how my whole approach in the life is to cut down the cost of IVF and make it more affordable.
Okay. So what is the gestation period? Is there a minimum period one should be ready to wait when they come to your clinic that I want to use IVF?
Well, we say to them that for one cycle of IVF, it will cost you between 1.8 to 2 lakhs of rupees. And what we try to do is we try to program the stimulation in such a way that with one set of injections, we can produce at least two sets of embryos. In that way, the cumulative success rate goes up, the cost comes down.
I have just seen 2, 3 cases in our families. Two of the couples got twins. So is that a propensity that when you go for IVF, there's chances of having twins?
Yes, so multiple pregnancy is one of the very common effects after an IVF because we usually put in two, and the government has regulations that we cannot transfer beyond three embryos.
Okay.
And it depends on the woman's age, but multiple pregnancy definitely is more rather than a spontaneous pregnancy. So
And actually, because I mean, the complications of multiple pregnancy are more, so that is why more and more people are now focusing on a single embryo transfer. And in Europe, it is the norm to transfer a single embryo transfer, whereas in America, it is still not yet so. In our part of the country, there are now a few centers who do only single embryo transfer. We also do single embryo transfer in certain cases, especially in elderly couples. But consider a couple who has come from Bardhaman doing IVF, needs the pregnancy desperately. We cannot afford to do that. We will put in two embryos to make the success. If by chance we find that the couple is not ready to accept a twin pregnancy, we will reduce the one pregnancy sonographically and make it single. Because single pregnancy, you must know the complications are much less in comparing to twin pregnancy.
and a lady who has come to you after four failures, then it's our desperation also that she gets pregnant, and that is when we transfer three. So after that, if there is a triplet, there are other methods to make it singleton by doing something which is called the fetal reduction.
What are the common side effects that one should be aware of?
The side effects are physical and mental and medical. Complications are OHSs, which is called ovarian hyperstimulation syndrome, which is usually with a lady with PCOS. We give her very minimal dose of injection, but she hyper responds.
I mean, like, what is the impact of that?
Actually, OHSS is the only complication in this business of IVF which can kill a patient. It carries a lot of mortality and morbidity. But having said that, the incidence of OHSS after change of protocols or advent of new drugs and the shift, as I said to you earlier on, from doing a fresh embryo transfer to frozen embryo transfer has virtually made it OHSS free today. In the last 2 to 3 years, we have not had any single course of OHSS I can remember. Minor complications which will happen, pain at the injection site, fever because of the pricks and all these things. things that are taken care of. There is no real such side effects in terms of the injections associated with IVF. So the whole thing is this, that we are trying to minimize the number of injections, the number of visits to the clinic to make the whole stimulation process more friendly. If the woman can do it from her home, and that is how a concept is now coming to play, that is called home IVF, where the woman first visits the clinic on the day two, takes the injection in the house, does the monitoring with the ovulation monitoring in a nearby ultrasound clinic, sends it to the clinic. The clinic tells them continue injections or add this, add that, and then again on a final day she comes to the clinic and the pickup is done 48 hours later. So that is how the whole thing is, to make it more simple, patient friendly, affordable, approachable.
Combination of advancement of technology in drugs or advancement of the procedure, and so combination of this, and also I think a lot of research were going on. End of the day, affordability is getting higher, right? And also that comfort যে um, বাড়ি থেকে অনেকটা করা যাবে rather than getting admitted to a hospital. That's wonderful. আমরা একটু সরে আসি, খুব সিরিয়াস আলোচনা করলাম, তো একটু একটা ব্রেক নিয়ে একটু আপনাদের প্যাশনের কথা জিজ্ঞেস করি। ডক্টর মিত্র, আপনি স্যার বললেন যে আপনি গার্ডেনিং করেন, বলেননি, আমি পড়েছি কোথাও একটা, অ্যান্ড আপনি ম্যাম বোধহয় ট্রেকিং করেন, সো হাউ অ্যাবাউট লিটল বিট হিয়ারিং অ্যাবাউট দোজ থিংস অ্যাজ ওয়েল?
ওয়েল, গার্ডেনিং করতে ভালো লাগে। আমার বাড়ির সাথে এটা বাগান আছে, আমার ক্লিনিকেও দুটো বাগান আছে। আই এনজয় দ্যাট। And every morning before coming to the clinic, I buy flowers for the clinic. তো সেটা ভালো লাগে, কিন্তু at the moment আমি টাইম ম্যানেজ করে উঠতে পারছি না। So once I retire from this profession, I have a lot of things I have planned in my mind to visit whole of India, to do all these things, read good books, talk to people like you, encourage young people to work, things like that I have in mind. But still, I mean, so far as I'm in active practice, I cannot manage that time.
Ma'am, how about you?
I like to trek, and I am associated with a woman only group. ওদের সাথে ট্রেক করতে যাই, যেরকম ভ্যালি অফ ফ্লাওয়ার্স, হিমাচল, লে লাদাখ গেছিলাম। আই এম ভেরি কমফোর্টেবল বিকজ দ্য টুয়ার অপারেটর ইজ আ লেডি। এটা করি, আর আমার এখন লেটেস্ট অফ লেট হচ্ছে কুকিং। সো মাই ডটার ইজ হিয়ার, সো শি ইজ লাইক আই হ্যাভ নেভার নট কুকড অ্যাট অল ফর হার অল মাই লাইফ। এখন আই এম ডুইং দ্যাট ফর হার।
আমাদের একটা 3 বছরের গোল্ডেন রিট্রিভার ছেলে আছে। বাড়ি ফিরে আমরা, ও আমাদের অপেক্ষায় বসে থাকে, আমরা ওর জন্য অপেক্ষা করি।
So, Dr. Mitro, I think the priority of becoming a mother is reducing to some extent. I have cousins who are very busy in their careers. They say it's okay, that's fine. We don't want to have a baby. So, is that a trend which you also observe, and afterwards they realize probably no, I want a baby, so that becoming a late pregnancy for those cases?
That is really becoming a real headache, এবং ওটা একটা বড় প্রবলেম হয়ে দাঁড়াচ্ছে যে 30 বছরে বললাম বিয়ে করবো না, 35 বছরে কেরিয়ার করতে ব্যস্ত, 40-এ গিয়ে হঠাৎ চারিদিকে প্রেশার, আবার নিজের ইচ্ছে তো দুম করে একটা বিয়ে করে বসলাম। তখন আমার AMH এর ভ্যালু হচ্ছে পয়েন্ট সামথিং, ওভারিতে 2টো ডিম দেখা যাচ্ছে। হাজবেন্ডেরও, ওনারও বয়স হচ্ছে, হয়তো ওনার ডায়াবেটিস আছে বা প্রেশার আছে, ওনারও স্পার্ম কাউন্ট সেরকম, তখন বাচ্চা চাই। তখন আমরা পড়ি মোয়া ফাঁ পড়ে। এদিকে মহিলা নিজের ডিম ছাড়া IVF করতে রাজি নন, আর হাজবেন্ড নিজের স্পার্ম ছাড়া প্রেগনেন্সি করতে রাজি নন। তখন ইটস এ রিয়েল ট্রাবল, এন্ড দ্যাট সর্ট অফ পপুলেশন ইজ গ্রোয়িং। So in every clinic, the age of the woman, the age of the couple, and the complexities involved are becoming a problem, and we have to tackle them in an individualistic way, depending on the social status of the couple, educational status, the financial background, the need for a child. So all these things have to be taken into account. Also, it is seen that a lot of young girls are coming with the ovarian aging, where their antral AMH levels or anti-mullerian hormone levels are low, which is a marker of ovarian reserve. And on sonography, you find that there are only 2 or 3 follicles in the ovary. So these sort of patient population are increasing, and with the change in the social atmosphere, work culture, environmental pollution, semen is also taking its toll. So much so that WHO in the last 20 years has decided to reduce the normal sperm count level, normal semen levels to a quite a bit extent, declining sperm parameters of the male all over the world. Those are the challenges of the that is coming for the reproductive medicine specialists in years.
Egg and sperm quality is diminishing.
So,
And
what is the reason for that? Is it a lifestyle issue or how is it?
Yes, age, lifestyle issue, the work they're doing, the stress that is involved, and environmental pollution, all of these things are involved. The food we take, everything's good. Nutrition is a very important thing.
So, taking clue from some of the things, Dr. Mitro, which you said, which you mentioned, um, one of the things that you said is aging of the ovary, right? So, what are the symptoms of it? How does a lady know that her ovary is aging and that needs to a certain medication or medical consultation?
Well, the symptoms, what they encounters is that her menstrual cycles become shorter. That is one of the earliest signs of ovarian aging. And then if she goes to a doctor and the doctor does a specific investigation by measuring the anti-ovarian hormone levels and doing an antral follicle count, then she will have a realistic picture of really how much ovarian reserve is it. Now, depending on that and depending on the needs of the woman, lot of women in the Western world or even from our country had decided to freeze their eggs
Yes.
so that they can use it for later years. So that is one way of saving the eggs or a sort of fertility assurance for the woman that she has an egg stored which she can use in later days for a pregnancy. But having said that, it is easier to freeze embryo rather than eggs. And the chances of pregnancy with embryo freezing are more than chances of pregnancy with an egg freezing. But not many of these women, especially in our countries, they don't have partners. So they have to rely on egg freezing.
No, but one quick question here. Say there is a couple, right? And they want to delay their pregnancy for some reasons, for career reasons, or whatsoever. So if they go for this method that they freeze their embryo, is that also like they can store it for certain number of years and then they can go for a baby in a future
Sure.
timeline? Okay, that is doable. So, what are just for our listeners, maybe it will be very good. You said the ovarian aging can be one of the symptoms is shortening of the menstrual cycle. So, what is a normal menstrual cycle, and what is a shortened menstrual cycle?
Common menstrual cycle is 28 plus minus 7 days. If the cycles are becoming 20 day cycles, 25-day cycles, like that, that is one or irregular cycles, those are the signs of ovarian aging. So one should then get his brain ticked or aware about it and so as to consult a proper doctor about that.
Good.
And another thing is a lot of girls are now having an early puberty. They
Yeah.
are have a puberty at 9. নবছরেই মেন্স শুরু হয়ে যাচ্ছে মারা এসে বলে ম্যাডাম this thing. So these are again because the woman is born with a fixed number of oocytes. তো তার যখন early puberty হয়ে যাচ্ছে তো at least we as doctor we should counsel them that they should at least complete their family early, and career can still wait, but the biological clock ticks, and there's then that is not dependent on.
But
Things are much easier if it's earlier.
But what you said that if the couple is, I mean, if they're married, they can still, have their embryo stored and use it at a later date. Because aging of the uterus doesn't cause much problems. Aging of the ovaries cause much bigger problems. So if you have embryo stored, then we can use it for a later conception. That is a very practical way. The idea, I'll give an example. We have a lot of patients who had their first pregnancies have had frozen embryo transfer, when have their embryos frozen in our laboratory. They comes back after 3 or 5 years later on for the second baby. And we transfer those embryos, giving a success. So with one set of embryos, they have, one set of pickup, they have two babies now. So that is actually possible.
Quite fascinating, actually. Exactly.
So much to
Fascinating.
learn. Like I came to know about this freezing of eggs and sperms from a Netflix series of Masaba. Otherwise, I was not much aware.
I have a niece who was just mentioning it to me that I don't want to get married now. So I'll freeze my eggs. First, the one good thing, these cases are no more like, a hush hush, that's something, we will not talk about, a taboo and all that. ম্যাম আরেকটা জিনিস যেটা জিজ্ঞেস করছিলাম, আজকালকার অনেক মেয়েদের আজকাল ওই পিসিওএস বা পিসিওডি, তো এইটার কি রিজন? এটাও কি ওই লাইফস্টাইল রিলেটেড বা কিছু?
ভীষণভাবে, because আজকাল বাচ্চারা, they don't go out, they are all, everything is indoors. They're either watching the video, and the habit, the mother usually tries to give a packet of chips, khao chole jao. And I see my patients, who conceive from very early age, বাচ্চা খাবে বলে একটু ভিডিও মানে মোবাইল চালিয়ে দেয়, and later ভীষণভাবে মোবাইল চালিয়ে দেয়, বাচ্চাও খাচ্ছে, মাও হ্যাপি। লট অফ ইয়াং উমেন, অ্যাজ ডক্টর মিত্রর কাছে আসে, ইয়াং পিসিও মেয়েরা, মানে ওদের সেন্ট্রাল ওবেসিটি হয়, যদি একটা বাচ্চা মেয়ে তাকে জিজ্ঞেস করলেই তার মাথায় যেন প্রচন্ড স্ট্রেস, আর মাও তার সাথে এসে, দ্য মাদার কামস অ্যান্ড টেলস, ডাক্তারবাবু 3 মাস মাসিক হয়নি, কি হবে? অল দ্য ফোকাস অফ দ্য প্যারেন্টস ইজ দ্য বাচ্চা, and this is more stress. The more you are concerned, periods আরো defer করে, আরো ডিলে করে। তো
আর অ্যাকচুয়ালি পলিসিস্টিক ওভারি মানে হচ্ছে যে মেয়েদের যেরকম মেনস্ট্রুয়েশন হলে যে কোনো একটা ওদিকের ওভারিতে এক্স ম্যাচিওর হতে আরম্ভ করে, সাধারণত মেন্স শুরু থেকে 12 থেকে 16 দিনের মধ্যে একটা এগ ম্যাচিওর করে একটা জিনিস হয়, সেটাকে বলে ওভুলেশন। এই ওভুলেশন হলে পরে তার 14 দিন পরে পিরিয়ড হয়, আর যাদের বিয়ে হয়ে গেছে প্রেগনেন্সি হয়। এই পিসিওর ক্ষেত্রে এই যে ম্যাচুরিটি অফ দ্য এক্সটা ডিস্টার্ব হয়ে যায়, অর্থাৎ এদের ওভারিতে মুক্তোর মালার মতো ডিম সাজানো থাকে, সেটাকে বলে পলিসিস্টিক ওভারি। এটা বেসিক হরমোনের গোলমাল হয়, এবং এতে হাইপার ইনসুলিনিমিয়া, হাইপার অ্যান্ড্রোজেনিমিয়া হয়। ইনসুলিন লেভেল বেড়ে যায়, অ্যান্ড্রোজেন লেভেল বেড়ে যায়, তার ফলে এর ওজন বৃদ্ধি পায়, আর যত ওজন বৃদ্ধি পাবে এই গোলমালটা আরো বেড়ে যায়। অ্যান্ড স্ট্রেস ইজ দ্য আদার কালপ্রিট হুইচ প্রিডিউসেস দ্য কন্ডিশন। আর যাদের ফ্যামিলিতে ডায়াবেটিস আছে তাদের এই জিনিসটা আরো বেশি হয় মেয়েদের। এবং ডায়াবেটিস is a genetic disease unmasked by two factors, body weight and stress. So lifestyle modification is a very important thing which has to be practiced by all PCO girls irrespective of the age, be it 15, be it 20, be it 30, be it 40, because PCOS can affect also in the later years of life. It is not only a disease of the young or the adolescent, it is also of the reproductive age and post reproductive age, মানে যাদের বাচ্চা হয়ে গেছে তাদেরও পিসিও হতে পারে।
Sedentary lifestyle is a killer. Problem is the kids do understand, but they don't have that maturity to handle it also. You have brought in that counseling element. When parents say kids don't listen to that extent, but when a doctor tells, it creates wonders, right? So we এখানে medication এর থেকে counseling টা বোধহয় বেশি help করে ওদেরকে।
IVF, embryo freezing, all this, we are putting it as art, right? Assisted reproductive technologies. Are there any other forms of art which are coming up with
Actually,
technologies?
art encompasses two basic things: intrauterine insemination and in vitro fertilization. Now, in vitro fertilization, there are different aspects. One is in vitro fertilization, normal IVF. The other is ICSI process. That means where the sperm count is low or motility is poor. Now, there are some instances where the man doesn't have sperm in his semen sample, but whereas he has sperm inside the testis. So, extraction of that sperm and then injecting into that sperm into ova is called ICSI, with testicular sperm extraction process. So it is another type of IVF. The other types of IVF is if the woman doesn't have an egg, IVF with donor eggs. If the man doesn't have sperms absolutely, or his process has failed, then IVF with donated sperm. If both of these compromise, they need a family, we do IVF with donated embryos. So these are the various forms of IVF. And lastly, the woman who doesn't have a uterus, or the uterus is compromised in such a way so that she cannot carry a pregnancy, then the question of surrogacy arises. Now, surrogacy is a very difficult process nowadays after the inception of the ART law in 2022. It is really a difficult process. You have to obtain permission from local ART authorities, then they send it to center, and it takes about a year or 2 years sometimes for the permission to arrive. So that is really a tough and tedious process. These are the different ranges of ART or assisted reproductive techniques, but we call it art. This is really an art, a science, and a prayer at the last.
So how do you spend some time in generating awareness within the population, or is there any mechanism to do it?
Well, we try to generate the awareness program by contributing different articles to papers, putting an awareness campaigns or in the media about the uh, availability of IVF and all these things, so that the couples, the population in such becomes aware of the IVF. But having said that, the population itself nowadays is not motivated. They get information from the different social medias, and a lot of them are mentally prepared. So we get patients from districts where, married for 10 years, had ordinary medical treatments, and comes to us saying that আমরা IVF চাই, আমরা আর কিছু চাই না.
Yes.
So they are ready in that way. এই জন্য জেনারেল অ্যাওয়ারনেস যেটা 20 বছর আগে যে ছিল, এখন অ্যাওয়ারনেসও বেড়েছে, চাহিদাও বেড়েছে, কমার্শিয়ালাইজেশনও বেড়ে গেছে।
Like Shukarna told that people are talking about it. They are more vocal nowadays. There are two sets who are very, very clear in their thoughts. কিছু আছে যে আমি পেট পেরেন্ট হয়ে থাকবো, আমার বাচ্চা টাচ্চা চাই না, হিউম্যান, আই ওয়ান্ট টু বি আ পেট পেরেন্ট। ওরা হাজবেন্ড ওয়াইফ খুব বন্ডেড, ওইসব নিয়ে বাচ্চাটা ওই পেটটাকে স্কুলে পাঠাচ্ছে। হ্যাঁ, ডাবল ইনকাম নো কিডস জানি। তো ওরকম আর আজকাল অ্যাওয়ারনেস, মানে অ্যাওয়ারনেস তো হয়। আমি আমার স্মল বিট যেটুকু করি টু দ্য সোসাইটি, কোনো বিয়ে বাড়িতে গেলে বলি বাচ্চা কাচ্চা বাবা তাড়াতাড়ি নিয়ে নিও, লাইক ঠাকুমা আই টেল দেম, মানে ওইটুকু মাই লিটল কন্ট্রিবিউশন বিয়ের পিঁড়িতে আমি বলে আসি, মানে আই ফিল গুড দ্যাট আই এম ডুইং সামথিং, মানে অ্যাটলিস্ট বললাম তো, তারপর শুনলো কিনা দ্যাটস আ ডিফারেন্ট
মানে
ইস্যু।
দিদি ট্রাইস টু ক্যাচ দেম ইয়াং।
একে বলে
আপনাদের কোনো সময় মনে হয়েছে দিস ইজ সো চ্যালেঞ্জিং?
যখন রেজাল্টস এ ফেলিওর আসতে আরম্ভ করে, দেন ইট ফিলস লাইক এ রিয়েল চ্যালেঞ্জ। এক একটা স্টেপ যায়, যখন আমার ধরো কালকেই আমাদের মানে গত 3 দিনে আমাদের 5-6টা IVF পেশেন্টস এর প্রেগনেন্সি লস হয়ে গেছে, অ্যাবর্শন হয়ে গেল। তো দেন ইট বিকামস এ রিয়েল চ্যালেঞ্জ, যেটাকে ওভারকাম করবো কি করে। যখন সাকসেস রেট কমে যায়, সে দ্যাট বিকামস এ চ্যালেঞ্জ, হাউ টু ইমপ্রুভ দ্য সাকসেস রেট। এগুলো হচ্ছে আমাদের নিজস্ব ওয়েতে ট্যাকল করা যায়, নিজেদের ল্যাব ইমপ্রুভমেন্ট করে, নিজেদের ক্লিনিক্স ইমপ্রুভমেন্ট করে, পেশেন্টকে কাউন্সিল করে। But what is also more challenging now, coming more and more, is the government rules and regulations.
it's not a very smooth runway for both of you, I'm sure. মানে এর মধ্যে তো একটা ইমোশনাল ups and downs ও আছে, and I'm sure when you get empathetic with the patient.
এভলিউশন অফ আইভিএফ বা আর্ট, ধরুন প্রথম থেকে আপনারা যখন শুরু করেছেন আর এখন থেকে আপনারা অনেক পার্সেন্টেজ চেঞ্জ দেখেন ট্রেন্ড ওয়াইজ। ওয়্যার ইজ ইন্ডিয়া স্ট্যান্ডিং ইন দিস পিকচার?
Actually, as the need for IVF is increasing and the awareness for IVF is increasing, it is becoming a very big market. And like all other medical industry, this ART industry is also increasing by leaps and bounds. So তার একটা প্লাস পয়েন্ট আছে যে অ্যাভেলেবিলিটি অফ ক্লিনিক্স, মানে অনেক পেশেন্ট অনেক বিভিন্ন জায়গায়, রিমোট জায়গায় IVF করতে পারে। কিন্তু তার একটা ব্যাড সাইডও আছে, সেটা হচ্ছে অ্যাজ বিকজ কমার্শিয়াল হাউসেস আর কামিং উইথ IVF ক্লিনিক্স, ওদের কেস দরকার, তাতে দে ডোন্ট বদার অ্যাবাউট সাকসেস হতে, দে ওয়ান্ট আমার এই মাসে এত নম্বর কেস দরকার আছে। তো সেটা একটা বাজে জিনিস। পেশেন্টস হু ডোন্ট নিড IVF, they also are pulled into IVF. Not all patients of infertility need IVF. About 30% of patients of infertile couples will need IVF. The rest can conceive with their other treatments as well. But সেটা আমরা ক্রমশ ভুলে যাচ্ছি, যেটা আগে এরকম ছিল না। আগে আমরা IVF-টা মোটামুটি একটা সার্টেন স্টেজে অফার করতাম, বা যার রিয়েলি দরকার তাকে ফার্স্ট স্টেজে হবে, মানে যেমন যার টিউব ব্লক আছে তাকে প্রথমেই IVF বলতে হবে, তাকে উল্টো পাল্টা ট্রিটমেন্ট করে লাভ নেই। কিন্তু তার মাইনর ডিফেক্টস আছে, তার বয়স অনুযায়ী, যদি তার বয়স কম থাকে আমরা বলতে পারি কিছুদিন ট্রাই করুক, না করলে IVF করুক। সেইটা ক্রমশ চেঞ্জ হয়ে যাচ্ছে। পিপল আর অলসো যে আমার বাচ্চা তাড়াতাড়ি চাই, আমার এরপরে কেরিয়ার করতে হবে, এটার জন্য সব আটকে যাচ্ছে, সেই জন্যই লোকেরা ঝাঁপিয়ে পড়ে IVF করছে। তাতে আরো ফেলিওর হচ্ছে, ফ্রাস্ট্রেশন বেড়ে যাচ্ছে। এইসব মিলিয়ে জগৎটা হচ্ছে, so there is a definite change in the pattern of IVF or in the market of IVF what was there 50 years before, because
One question. um, do you see any corruption coming? কেন জিজ্ঞেস করছি প্রশ্নটা হচ্ছে যে এটা তো খুব সেনসিটিভ একটা জিনিস, when a couple comes, they come with lot of expectation. It's so sad when they get, handled differently, right? If there is, how do the patients know where to go and to avoid certain places?
malpractice is there. We have to be very scrupulous in our practice, and that we maintain certain ethics or codes of conduct in this particular field, and we do not work beyond the ART laws. যেমন এআরটি ল বলছে পুরুষের বয়স 55, মহিলার বয়স 50-এর বেশি হলে আইভিএফ করা যায় না। The other thing is this, that the couple's gamete has to be individualized and that has to be maintained. Mixing of gametes is not allowed, not advised, not advocated, should not be practiced at all.
Without the consent.
Without the consent. So that is where the malpractices are coming into play. They should be scrupulous in their practice.
Now, with the advent of this ART law, এখন অনেক regulated হয়েছে ব্যাপারটা। আর এখন lot of couples need something which is called a third party reproduction. মানে husband and wife কে beyond a third party. এখন অনেক বেশি, after the new law which has come, এটা এখন ভীষণ strict হয়ে গেছে। But then there are patients also who are like, মানে এত জেনেই আসছে ক্লিনিকে।
So we wind up the small message to all our viewers. Keep listening to us, encouraging us, and we will bring more interesting episodes in future. Follow us in our social handles. Thank you. Bye bye.